Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, and Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. When you're living with MS, managing your pelvic floor health may not be the first thing on your mind. But pelvic floor dysfunction and the problems that relate to it, like bladder and bowel issues, can become significant. Focusing on pelvic health rehabilitation can have a positive and meaningful impact on your well-being and your quality of life. Jill Ehrmantraut is joining us today to explain the important role pelvic floor rehabilitation plays in managing MS. And Jill's going to share some strategies and insights designed to empower you on your path to achieving a healthier pelvic floor. Jill is a physical therapist and a women's health clinical specialist with advanced training in pelvic rehabilitation for women, men, and children. Welcome, Jill, and thanks for being with us today.
Yes, thanks for having me. I'm excited to be here.
Well, let's start with the basics of pelvic floor health and pelvic floor rehabilitation. What are the pelvic floor muscles and why are they important?
Yes, so the pelvic floor is a group of muscles that sit at the base of the pelvis, and they really have three kind of main jobs or functions that can be really important. Function number one is they help support all the pelvic and abdominal organs. So this would be the bladder, rectum, colon, stomach from the bottom up. Number two, they do have a sexual function. So they function in erection, both in males and females, and also a pleasure response during intercourse. And then another important function, which you kind of touched on a little bit, they function very much so in bowel and bladder control. So I kind of think of it like a clamp on a hose. They surround the urethra, which is the tube that carries urine from the bladder outside of the body, and also the anus. So when they're nice and strong, they clamp those shut to keep you dry. On the flip side, they need to be able to relax all the way to be able to go to the bathroom effectively. So it's a group of muscles a lot of people don't think about or are aware of, but they're really important.
So what is pelvic floor rehabilitation and how does it help manage symptoms related to MS?
Yeah, so pelvic floor rehab is physical therapy for your pelvic floor muscles. You know, they're muscles just like anywhere else in the body and unfortunately can be affected by MS. So we first start by assessing the muscles, seeing if maybe they're not as strong as we want them to be, or if they're too tense or tight, which individuals with MS, that tends to be more the case, but they can be both at the same time. So by going through pelvic floor rehabilitation, we help the muscles really function the best they can. And because they have such an important function in bowel and bladder control and keeping you dry, but also being able to go to the bathroom, by getting the pelvic floor to really function optimally, we can help decrease any bowel and bladder issues that might be present.
Can you tell me about specific techniques or exercises that are typically included in a pelvic floor rehab program for people with MS?
Yes, well, so physical therapy exercise obviously is kind of the first thing we think of. One really important exercise that most people have heard of and probably never done is called a Kegel. That's basically just contracting and relaxing your pelvic floor. The interesting thing about Kegels is research has found about half of the people aren't doing them correctly, whether they're squeezing on their muscles or pushing down rather than squeezing up and in. So by working with a pelvic floor therapist, we make sure you're doing that the right way. Whatever other muscles might need work, so maybe core strengthening, hip strengthening, or even coordination types of exercises if the muscles are too tense, to kind of teach the muscles how to relax. One tool I have to help with coordination is called biofeedback. So it's surface EMG. We put little electrodes on your bottom and then hook you up to the computer, but it kind of looks like a heart rate monitor for the pelvic floor. What's really nice about that is you can't see what your pelvic floor is otherwise doing, so it's kind of hard to learn how to control it. So by doing the biofeedback, you can actually see in my clinic, I have it on my nice computer screen. You can see it. So that helps improve the connection between the brain and the muscles and helps with control for that.
Well, we've heard from Mary, who's wondering if there are potential side effects or risks that individuals with MS should be aware of when they're undergoing pelvic floor rehab.
Yeah, so that's kind of the nice thing about physical therapies. There really aren't that many side effects or risks with it. One side effect possibly is, so say we're working on a lot of maybe strengthening types of exercises, you might be a little bit sore for a few days. That wouldn't be any different than if you're starting a new exercise routine and doing different strength type of exercises where your muscles might get a little bit sore, but that will go away over time. I also like to do a lot of hands-on manual therapy through muscles that might need it, including the pelvic floor. And again, sometimes patients might be a little bit sore the first couple times we do that for a day or two, but it's something that goes away. So really, besides maybe some minor soreness for some people that's short-lived, that's the nice thing about PT is there really isn't any other side effects with it.
Well, I think you've already started answering the first part of my next question. I was going to ask you, how does pelvic floor rehab contribute to the overall quality of life for individuals with MS? And with regular rehab sessions, how long does it usually take to see improvements in pelvic floor function?
Yeah, so first part of the question, you kind of talked about this a little bit in the intro. Until you experience maybe bowel or bladder issues, you really don't know how much it can affect your quality of life. So how many times I've heard patients say, I know where every bathroom I'm in Fargo. I know where every bathroom in Fargo is, in this store, this restaurant. I always come with a change of clothes, things like that. It really can affect your quality of life. So by working with pelvic floor therapy, because it affects bowel and bladder function so much, we can positively impact some of those quality of life issues where you can go out for supper maybe and not have to go to the bathroom a couple of times or pack a change of clothes. So it really does positively impact the quality of life of these patients. Second part of your question, we usually want to see some degree of symptom improvement within about a month or so. Most of my patients I'll see once a week, sometimes twice, kind of depending on what we need to do. We will most likely start to see changes in strength and maybe muscle coordination and things like that within a couple weeks. But to see symptom improvement, so maybe bowel and bladder changes, can take a month. But that's just starting to see changes. Usually 3 to 6 months of being kind of consistent with exercise is what we're looking at to really get the maximum improvement out of this.
So what would you say are the long-term benefits of incorporating pelvic floor rehabilitation into a comprehensive management plan for someone with MS?
Yeah, unfortunately for a lot of individuals with MS, it's progressive disease that tends to get worse over time, and that does not discriminate against bowel or bladder issues. Constipation might get worse over time. Feelings of emptying your bladder might get worse over time. So by starting a pelvic floor rehabilitation program, we can keep the muscles functioning as best we can over a long period of time. By trying to maintain or restore muscle function as early as we can, that can maybe slow some progressive effects of MS. It might even make it so down the road, some progressive effects might not be quite so severe because the muscles are already functioning that much better, that we might be able to slow some of those processes that might happen down the road.
Well, this has been a great overview. Let's drill down a little bit further. How does MS specifically affect the pelvic floor in women, and what are some common related symptoms that might be experienced by women who are living with MS?
Yeah, so we're going to typically see one of two things with the pelvic floor, and actually we can see both at the same time, honestly. A lot of times the muscles will become weak, and that can lead to maybe some more bladder or bowel incontinence, leakage types of issues. So again, the pelvic floor clamps down on the urethra or the anus. I'd liken it like a clamp on a hose. The stronger it is, it can clamp the urethra shut and you won't leak urine. When they're not as strong as we want it to be, that hose isn't clamped all the way shut, and we might experience some leakage or incontinence issues. What we will see more often than not in patients with MS, muscles usually are weak, but they're also over tense. We kind of call it overactive. They can't relax the way we want to. They're kind of stuck in a contraction all the time. This sometimes will present a little bit different with bowel and bladder issues. This can contribute to constipation, which we'll see a lot in these patients. The pelvic floor surrounds the anus, so it needs to be able to relax the way we want it to allow you to have a bowel movement. When the muscles don't relax very well, it's kind of like you're trying to have a bowel movement through a closed opening, essentially, and that can make constipation issues worse. With the bladder, because the bladder sits right on the pelvic floor muscles, when they're tense, they'll push up on the bladder, they can irritate it a little bit, and that will cause urinary frequency, so you're going to the bathroom more often than you should. Feelings of urgency, like you need to rush to the bathroom, you're not going to make it in time. Also, feelings that you're not emptying your bladder all the way. Because again, clamp on a hose, I use that a lot. But if that clamp can't relax all the way and open up, urine isn't going to flow out as easy as it normally should. So those are going to be some of the things we'll see more often than not.
How can pelvic floor rehab help manage menstrual-related pelvic pain or discomfort in women with MS?
So a lot of times kind of menstrual pain will come from the uterus itself. That'll cause some discomfort. A natural response of our muscles is to kind of tense and guard against pain, which when you think of it like you touch a hot stove and you pull away, that's what we want. But when it comes to other issues, so say you're having menstrual pain and your pelvic floor tenses because of that we maybe don't necessarily want, because now we're going to have tight muscles on top of it. And just like muscles that might be tight, so say your low back, or if you have tight muscles up here that cause headaches, that can cause more pain. So when the pelvic floor is tense and tight, guarding against that pain, we're going to have muscle pain on top of it and make things worse. So pelvic floor physical therapy, in that instance, we're going to focus more on relaxation types of exercises, stretching types of exercises, some hands-on soft tissue releases through the pelvic floor and even the lower abdomen to get those muscles to kind of relax and let go. And that can help decrease pain-related issues.
Jada recently had a baby and was just diagnosed with pelvic organ prolapse, a condition where the organs inside your pelvis drop or fall and are sitting lower than they should. How can pelvic floor rehab help with postpartum pelvic floor issues in women with MS?
Yeah, so kind of like earlier, the very first question, one of the functions of your pelvic floor is to help support all of those organs. So during pregnancy and childbirth, and this can be vaginal or a C-section, your pelvic floor has been working extra hard for 8 to 9 months, let's say, on holding a baby and all of that. So they're kind of tired and not as strong as they should be. And because they support those organs from the bottom up, when they're not as strong as they should be, the organs are going to drop a little bit. And that's when we can get prolapse. So by strengthening through the pelvic floor, we can help support those organs from the bottom up, and that can help improve pelvic organ support with a prolapse, and also any other symptoms that might come along with that.
Are there specific exercises or lifestyle changes that have been proven effective in strengthening the pelvic floor muscles in women with MS?
Yes, absolutely. So number one is going to be Kegels. That's really just contracting and relaxing through the pelvic floor. You know, it's just like doing it. I mean, even a bicep curl to strengthen your bicep, a contraction exercise anywhere else. Kegels are kind of the bread and butter in strengthening the pelvic floor. I also like to do a lot of hip strengthening. So sometimes squeezing a pillow between your knees or pushing your knees out against a band. By strengthening your hips, it has been proven actually to kind of overflow into the pelvic floor and improve pelvic floor strength. Also a lot of core strengthening, because all those muscles work together. So I'm improving strength in one. So say core strengthening, we're going to improve strength in the pelvic floor as well. And there are lifestyle changes that are fairly, I think, pretty easy to implement that can help improve bladder function. So number one that we see a lot is making sure you drink enough water. A lot of patients with bowel and bladder issues actually cut back on their water because they think it's going to be helpful. You don't have to go so often. You might not leak, things like that. But actually, when you're not drinking enough water, the urine that is in your bladder becomes a little bit more concentrated. So we've all seen it before. Well, I'm weird and I look at the color of my urine, but I'm trained to do that, right? So you go to the bathroom and your urine is maybe a little smellier than normal, or maybe a little bit darker yellow. That type of urine is irritating to the bladder, and that's what's going to happen when you're not having enough water. So actually, by drinking enough water, we can decrease trips to the bathroom and leakage. Another thing, there are certain foods and drinks that can irritate the bladder. So common ones are going to be carbonated beverages, caffeine, spicy foods, kind of acidic foods, that sometimes if you are sensitive to that, by cutting back on those kind of things, we can actually see improvement in bowel and bladder function as well.
Well, we've heard from Craig, and he's wondering how MS specifically affects the pelvic floor in men, and what are some common related symptoms that might be experienced by men with MS?
Yeah, so that's kind of maybe the nice thing about pelvic floor. It's going to affect both men and women fairly similarly, where again, they may be weak, but we're also going to tend to see muscles that are kind of over tense. The interesting thing in men is pelvic floor tension, which can happen with MS, can also kind of mimic prostate enlargement types of symptoms. So maybe not emptying your bladder well, poor urine stream, frequent trips to the bathroom, urgency, constipation, things like that. So with those symptoms, specifically in men, we do want to have a prostate screen, even as PSA, just to clear things out. But I've had a lot of men that we've done pelvic floor rehab and really resolved a lot of those symptoms as well.
Are there any specific exercises or lifestyle changes that have proven effective in strengthening the pelvic floor muscles in men with MS?
Yeah, that's kind of the other fun thing. They're really going to be very similar. So Kegels, men, they have a pelvic floor too. So doing Kegels, contracting, relaxing through the pelvic floor, hip core strengthening. A lot of men kind of tend to develop more firm, harder abdomens, not in a good way as they get a little bit older and with MS. So doing some hands-on releases to kind of release through that, deep breathing types of exercises can all help improve the function of the pelvic floor. And then sort of the same lifestyle changes, enough water, decreasing bladder irritants, things like that.
Brian tells us that he's heard that pelvic floor rehabilitation can help address sexual dysfunction or decrease sexual satisfaction among people with MS. And Brian wants to know whether that's true.
Yes, actually, pelvic floor therapy has been proven to help with sexual function and pleasure, both in men and women. So a little bit of both, but maybe more specifically geared towards men. Your pelvic floor needs to be able to relax really well to allow blood flow into the penis to attain an erection, but also contract to maintain it. So that's going to be something that's important. We need to have good coordination to relax, but strength to hold that in. By doing pelvic floor therapy and Kegels, we improve blood flow to the pelvic area, and that for both sexes can help improve sexual satisfaction. And they also are involved in orgasm or the pleasure response, and that's more of a strength and coordination thing too. So the better functioning those muscles are, the better sexual experience individuals can have.
Lee wrote in, and they're wondering whether there are specific exercises or techniques tailored to the needs of transgender individuals undergoing pelvic floor rehabilitation, and how do they aid in postoperative recovery after gender-affirming surgeries?
Yes, absolutely there is. So this question is going to be hard to get specific because it really depends on maybe what surgeries were performed or what an individual feels like is right for them in a transition process, because maybe they want to undergo this surgery, but not this other specific surgery. But by working with a pelvic floor therapist, let's say first post-surgery, it's really similar to any kind of other surgical process. We want to make sure we have good motion within a scar tissue or joints that are close to the area. By doing sort of guided kind of specific exercises, we can improve blood flow to the surgical area, which can help with healing. Also, physical therapists are good at kind of going through modifying daily tasks. So usually after transgender surgeries, we'll have different restrictions. So we can kind of help go through maybe how to get through life with various short-term restrictions we might have. Physical therapy also can be helpful for individuals who decide that surgery is maybe not an appropriate part of that transition process or not at this time. So a couple of examples for that. So say a transgender man who is binding through his chest, that can sometimes cause restrictions to the front of the shoulder or the chest and cause pain. So exercises to kind of strengthen the back and open up through the chest a little bit. Or a transgender woman who's doing a tucking type of procedure can cause, I shouldn't say procedure, but like that's what they choose is right. That can cause growing pain and pulling through the abdomen. So different exercises to stretch through some of those structures can really be helpful for those people.
Well, you shared some great information with us today. What would you say are the top 3 takeaways that you'd like our viewers to remember?
Yeah, this was hard, but I think I've got them for you. Number 1, your pelvic floor really can be too weak or too tense, or sometimes both. The good thing is there are things you can do that we've kind of talked about, whether it's various exercises or lifestyle changes that can really help improve pelvic floor function and help improve your quality of life. And I guess to kind of piggyback off of that, number 2, lifestyle changes, make sure you drink enough water, avoiding any bladder irritants you may have, or things that people can do on their own even that might positively affect bowel and bladder function. And really, number 3, if you're experiencing any type of bowel or bladder issues, go and see a pelvic floor physical therapist. We're usually pretty much able to tell within a visit or 2 if we can help, number 1, which more often than not, we can. And then what kind of exercises you can do at home, what things we can do in the clinic to really help improve quality of life.
Thanks for sharing your expertise with us, Jill. We have some time. Let's answer a few more questions from our viewers.
Yeah.
We heard from Grace. She reached out and wants to know how she can find a physical therapist who specializes in pelvic floor rehab.
Yeah. So pelvic floor rehab is kind of interesting in that you do want to try to find someone who's had some training and experience, because it's a field that takes a little bit more to kind of learn about. One way is to go on our professional website. So it's the American Physical Therapy Association, or APTA. Oh man, I should have looked at this. It's either .com or .org. I'm sorry. But if you do one of them, you'll find it. There is a Find a PT tab up towards the top. So you can go in the Find a PT and enter your zip code, and it should find someone close to you. In the APTA, we have our own pelvic health association called the Academy of Pelvic Health. They will also have a Find a PT. There is another association called Herman and Wallace, and you can Google all these and you'll find it. And we'll also have Find a PT. A couple things maybe to look for someone who has a little bit more training would be a WCS, so Women's Health Certified Specialist, PRPC, Pelvic Rehabilitation Practitioner Certified, or CAP. Those designations just prove you've gone through more training and testing to be able to treat people of a higher level.
Alex is concerned about having embarrassing accidents when they have a strong urge to use the restroom, as well as how to avoid having to wake up to urinate in the middle of the night. You have any tips for Alex?
I do. So we have what we call urge suppression, and that's when you get that really strong urge and you're nervous you're not going to make it in time. So with urge suppression, there's really 3 things you need to remember. And this can be useful at night when you wake up and don't want to go quite yet, but this can be very useful during the day as well. So those 3 things are stop. I'll get into it a little bit. Kegels and breathing. So stop is basically don't rush to the bathroom right away, because what you've probably experienced is if you get that strong urge and you rush to the bathroom, it gets a lot worse the closer you get because your nervous system is ramping up a little bit. So stay where you are. Stop is number 1. Kegels, 5 to 6 pelvic floor squeezes, just kind of squeeze, rest. Because your bladder sits on your pelvic floor, you can think of the bladder being like the noisy neighbor upstairs, and doing a Kegel is like hitting on the ceiling with a broomstick and quieting it down a little bit. Step number 3 is breathing. So 3 to 4 good deep breaths that calms that urge and nervous system down. What should happen, you might need to do a couple of cycles of Kegels and breathing, but that severity of that urge should decrease so you can walk to the bathroom normally. Number 2, so nighttime, we do have a few tips that can help at nighttime. Number 1 is try to get most of your fluid intake during the day. I don't want you to cut back on water, but what we prefer is to have most of your fluids in before 2 hours of bedtime. If you need to take some water, maybe to take medications at night, that's okay, but we want most fluid intake earlier in the day. Another kind of strategy I like, we call it double voiding. So going to the bathroom twice, but only before bed. So you go to the bathroom, brush your teeth, whatever else you need to do, go to the bathroom again, just to make sure your bladder is fully empty, and then you go to bed. Those are a couple of things that can be helpful with waking up more often than you want at night to have to go to the bathroom.
Jackie would like to know how she can keep her bowel movements regular and avoid constipation.
Yeah, so water, we're going to go back to that, right? Your colon's job is to absorb water out of your stool. So if you don't have enough water, your stool is going to get extra hard and it's hard to go to the bathroom. Pelvic floor exercises, working on coordination of the pelvic floor, can help the muscles relax when you're actually on the toilet going to the bathroom, make it easier to go. There's also a certain position, sometimes sitting on the toilet can help relax those muscles and make it easier to go to the bathroom. So feet flat on the floor. I don't know if you're able to see me here. And then, not a whole lot, but leaning forward, resting your elbows on your thighs. That helps open up through the pelvic floor to make it just a little bit easier to have bowel movements.
Susanna tells us that she's aware of the benefits of doing Kegels, but she's uncertain that she's performing them correctly. How can she ensure she's doing Kegels correctly?
Yes, and it's a good question. As we said before, we found up to half of individuals, and that's not even, it's males and females, aren't doing Kegels correctly. I guess I should say number one, go see a pelvic floor physical therapist. We will be able to tell really immediately if you're doing them correctly or not. The nice thing about that is we can provide coaching on kind of how to do the Kegels correctly should you need. But if you're looking for a way to do it at home, when you're going to the bathroom and urinating, try to stop the flow of urine if you can kind of cut that flow off. Side note on that, we don't want people to be doing that on a regular basis. By stopping the flow of urine on a regular basis, it can kind of maybe confuse the bladder and pelvic floor a little bit, and actually in the long term make bladder issues worse. But every once in a while, to see if you can do it, just so you know you're doing the exercise correctly, then it's okay.
Well, I want to thank everyone who submitted some excellent questions, and thank you, Jill, for being with us today.
Yes, thanks for having me. It was a pleasure.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups, and you'll hear about ways to get involved and upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Jill for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Jill Ehrmantraut and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.